This is a training video for the staff on the Oliver Fisher Neonatal Unit to explain the procedure for the new Surfsup study that will commence at the beginning of September. For babies enrolled into the supraglottic airway group, you will need 3 people: a doctor or an advanced nurse practitioner as the airway clinician, and a doctor or ANP to administer the surfactant. The nurse looking after the baby will administer the sucrose and aspirate and remove the OGT, as well as swaddle and comfort the baby. For babies enrolled in the supraglottic airway group, there will be packs available. The first thing that you'll find is a TP circuit with a duckbill port. It is important to ensure that the duckbill port is patent by using the blunt needle also available in the pack to check for patency. The pack also contains a CO2 detector to be used with the I-gel. A size 1 I-gel is included with all packs. The pack also contains the surfactant giving set, which includes the syringe as well as the surfactant giving tube. Water-based lubricant gel is also included in the pack to be used with the I-gel. Always ensure that you have emergency equipment available prior to the procedure. This will include a face mask in the incubator, and the emergency trolley should be placed near the incubator. You will need to connect the TP circuit to the Neopuff system. It's important to check that your PEEP is appropriate for the baby, as well as a PIP. Here you can see Mason demonstrating this. For this patient, we've decided on a PEEP of 5. The I-gel will need to be removed from the plastic casing. You will need to lubricate the back and the sides of the I-gel by placing some water-based lubricant along the sides of the plastic casing. Always ensure that the surfactant is prescribed, checked, and drawn into the surfactant syringe and surfactant giving tube prior to starting the procedure. The procedure needs to be recorded on the GoPro camera that has been supplied for the study. It is important that you capture both the baby and the monitor with this recording. Placing the camera in the position located on the drip stand will capture this data. For babies in the supraglottic airway group, propofol will not be given. Sucrose should be given prior to the procedure as an analgesic. Atropine should also be prescribed and drawn up to be used only should the baby become bradycardic. The orogastric tube needs to be aspirated and removed to prevent pressure in the mouth when inserting the I-gel. This needs to be reinserted after the procedure. The baby should be swaddled and held to provide comfort. The recordings are to be used by the local research team only. This will help us accurately determine how long the procedure took and what the baby's heart rate and saturations were during the procedure. All babies randomized into the Surfsup study need to be recorded, regardless of whether they are in the supraglottic airway or in the LISA arm. The non-invasive respiratory support that the baby is on can be left in place during the procedure, unless removal is required to secure the correct position of the I-gel. Ensure that the I-gel is appropriately lubricated, and the suggestion is to place the CO2 detector on the I-gel, as this will give you instant feedback once it is inserted into the correct position. Mason demonstrates here how you insert the I-gel along the hard palate over the tongue. You stop when resistance is felt and you hold it in place. The CO2 detector should change to yellow to confirm that it is in the correct position. Should there be difficulty inserting the I-gel because the baby's tongue is in the way, you may use a tongue depressor or a laryngoscope to move the tongue. You can now remove the CO2 detector and attach the Neopuff set. Insert the surfactant catheter via the duckbill port to 16 centimeters. This is regardless of the size of the baby. The initial surfactant dose should be 200 milligrams per kilogram. This can be rounded up or down slightly to the nearest vial, as is our usual practice. Subsequent doses of surfactant, should they be required, will be according to the unit guideline. Shui is demonstrating here how the catheter has been advanced through the duckbill port up to 16 centimeters. The surfactant should then be administered very slowly over about 2 minutes, encouraging the baby to breathe. If the baby becomes apneic, try gentle stimulation first. Only ventilate via the I-gel if necessary. Otherwise, allow the baby to breathe in the surfactant. Once the surfactant has been administered, remove the surfactant giving set. Ensure that the surfactant is cleared from the I-gel prior to removing it. Ensure the non-invasive respiratory support remains in the correct position and place the baby back into the incubator. Please complete the post-procedure paperwork. This includes a clinician survey which will be undertaken by the person who is managing the airway. This includes both the LISA group or the I-gel Supraglottic airway group. Should you have any questions, please either discuss with myself or a member of the research team.